Okay, we are live. Good evening, everybody. All right, for those of you watching the replay, go ahead and comment replay in the comment section. I like to go back after shows are done and just kind of look through to see who is watching the replay. And also, if anybody who watches the replay has any questions, I like to pick up those questions and answer them as well. So it's been a very, very busy week in the Cosi Talks studio. We have such an amazing show lineup for the rest of this year. And I feel like they're just all starting to come out right now. So I'm so excited to share some of the things that we'll be doing this week with you guys and next week as well. So guys, as you jump on board, I see a few of you coming on board right now. Hey, Harsh, thanks for coming on board. All right, I have my microphone ready to go. And this time I'm not going to like bang it out of the way like I did last time with my hand gestures. Hey, Brian, Bustelo on the table. Oh, Brian, I was thinking of you this weekend. I was reorganizing my coffee bar. Yes, I have a coffee bar. I don't have a wet bar. I have a coffee bar. And I was organizing all of my Bustelos and all of my Café Pilon. Hey, Tom, glad you could join in. We got Chuck on board from a balmy Wyoming. I'm hearing the sarcasm there, Chuck. I'm hearing it. Andrea, there's my token occupational therapist. And we got Haravamsh. Holy smokes, that is my boy from India. I haven't seen you in a decade or so. Thank you for coming on board and staying up late for us. Hey, Lena, there's my comadre. We got Bonnie on board. Lori with her, yep, my coffee bar. I do. I'll have to do a show in front of it. It's a really pretty coffee bar. I'll have to do a show in front of that in one of these evenings. All right, who else we got on board this evening, guys? Don't be shy. Let me know who you are, where you're from, and more importantly, what's in your mug. Today, I've got my Cosi Talks, my merch, as my kids call it. You know, I got to do what the cool kids are saying. So I got my Diet Coke here ready to go. Jeffrey Cook having water. Jeffrey just sent me the most amazing video of him killing it with his stubbies. So we're going to be saving that video for some time soon. I think we're going to have to do that. Oh, no, glad you're here, Howard. I'm glad you made it. Hey, David, Pastor David's on board. It's a party. And guys, just so you know, I am broadcasting from the YouTube channel as well. So for some of you who prefer to watch me through the YouTube channel, there you have it. We've got Louie Angel on board from California. Louie, how's that running going? We got Lori with chocolate protein shake. Had one of those today. Lori, what do you like? What do you like for your chocolate protein shakes? All right, let's see what we got. We got a good crew coming on board, so we're going to go ahead and get started, guys. So for those of you joining me for the first time, welcome. My name is Cosi Belloso. I'm a physical therapist, amputee specialist here in Tampa, Florida. As you can see, I got Bob with me this evening. He might be doing some of the modeling here this evening. For those of you who are just new to the show, I do have a private practice here in Tampa that is exclusively for working with amputees. That is my passion. Oh, there's a second video, Jeffrey. Okay, yeah, I'll have to check that. I only saw the first video, so I'll check that after the show is over. So guys, I just had the coolest pre-interview with my special guest for next week. So how many of you guys are on my email list? Hey, compadre, what's going on? Thanks for being here, man. How many of you guys are on my email list? Let me just get a show of hands. If you are not already on my email list, you can go to my website there and sign up for it. Guys, I promise I don't spam your email inbox with a bunch of fluff. I only send out the important stuff. But guys, sign up. Good. Chuck is on my email list. Who else? Come on, where are my cool kids at? All right, there we go. We got David. Tom's on there. All right, guys. Awesome. Okay. So in the next few weeks, you're going to be getting a couple of emails from me with a bunch of really great stuff. Hey there, Chuck, checking in from YouTube channel. Hey, comadres there. Of course you are. All right. So next week, TMR Nerve is coming on the show. And probably some of you are like, TMR Nerve? Like, what's that? Who is that? So some of you on my show have heard me talk about the procedure, TMR, Targeted Muscle Reinnervation. And why that should hopefully start bringing some bells in your head is that is a procedure that is used to treat painful neuromas, okay? And as a result, help with residual limb pain and also phantom limb pain. Do I have your attention? Yes? Okay, I've always said the person who can find the cure for phantom limb pain is gonna like be a billionaire and have their own island. So while we don't have the cure for phantom limb pain, we do have several techniques and this particular procedure to help with this. Here's where the really cool part comes into play for next week. The surgeon who invented the TMR surgery, and he did this about 20 years ago, He's the one coming on the show. Yeah, that's right. That's my nerd mic drop moment. Dr. Gregory Dumanian, and I'm pronouncing his name correctly now. He will be on the show next week. Guys, this is the plastic surgeon who pioneered targeted muscle reinnervation procedure. Some of you have had this procedure done, right? Some of you have heard about it. Some of you have been having pain from neuromas, okay? I am giving you the source of this procedure, the man who invented this procedure, and has like my books in here, any book I have in here about TMR, it has his name on it. He's coming on my show next week. So if I seem like I'm a little bit of a fangirl moment right now, it's because I'm really excited. I've been learning a lot about TMR the past couple of years, and it's just wonderful to have the source here to ask all of our questions. So guys, next week, March 9th, 8:30 p.m. Eastern Standard Time, y'all are going to want to be here listening. And of course, we like to make it fun with some giveaways. So, that's always, and it's amazing. Like this guy has, wow, brilliant. Okay. So Bonnie says she's had a combination of TMR and RPNI. Yes. So yes. And guys, this is one of those things where TMR, it was originally, and again, I don't want to give away too much of the good stuff, but it's going to have implications down the line for, myoelectric prosthetic devices. It's already being used for the upper extremity, but the technology is eventually going to trickle down to lower extremity. Okay, so this is something that, keep in the back of your minds. Come listen to the talk. It's really great, really great. All right, let's look at some of the questions here. So I've been doing a lot of running on the show lately. My boy Damon has been coming on the show, and we're documenting his journey as he learns how to run. And any of you who have seen those running videos I've been doing with him, you might be surprised. Running is not as easy as just putting on the blade and taking off, right? There's a lot of things that have to be taken into consideration, not only to teach an amputee how to run, right, with the right gait mechanics and relearning that pattern, but also making sure that injury doesn't happen, right? Because running can be kind of brutal on the human body. So I've been getting questions as a result of that. Bonnie, I'd love to hear your response to that. Hey, Stephanie, glad you could join in. All right. So Jennifer sent me this question. She says, I have watched a few of your shows, very informative. I've been a below the knee for 2.5 years. I am a 43-year-old mom who's always been very active. My amputation is a result of septic shock. It's taken me quite a while to get my strength back up to where it used to be. I'm finally getting to the point where I feel like I would like to start jogging again and getting back in shape. A couple of weeks ago, I started doing the Beachbody Insanity program. I'm enjoying it, but the leg I have is very limiting. I have a suction sleeve and a hydraulic ankle. Is there a better suspension system for me? It's difficult to do many things due to the lack of range of motion in my knee. Also, can you recommend a foot for working out and jogging that is not a blade? Okay, so lots of questions in here, but lots of really good questions that I want to answer, okay? So this is obviously a younger mom. She's very active, okay? So, and she's wanting to get back into higher level activities, right? The Beachbody program, it's a pretty, high level activity, a lot of intense balance and a lot of strengthening, a lot of that going on. So she has a hydraulic ankle and a suction sleeve. And I love hydraulic ankles, guys. I've got a couple of patients who wear hydraulic ankles, specifically the one, Blatchford's, the Elan and the Echelon, right? Great hydraulic ankle. I've got a couple people who are very happy with it. They feel very connected to the ground, okay? So here's the thing with prosthetic feet, though. The more stable they are, right, less mobility. And then the flip-flop is also true. The more mobility you might have with a prosthetic foot, less stability. Right? So if you have someone who's got a really nice, stable foot, but they want to be up and moving and doing exercises and they need more mobility, that stability in the foot might be limiting them just a little bit, right? And it's not so much like in this particular case, I think a suction sleeve is perfectly fine. It might mean that she needs an extra suspension sleeve on top to kind of just really hold that leg in. But for someone like Jennifer, right, I foresee her being someone who does a fitness program several times a week. Hey, Rhonda, thanks for joining in. She seems like somebody who's going to be very, very active. So when I have someone who's very, very active, this is where I start talking to them about perhaps making a leg just for exercise. right? So the same way we have different shoe types for the different activities we do. We have sandals for when we go to the beach, right? We don't want to wear our nice leather shoes to the beach, right? We have our church shoes, our slightly nicer shoes. We have our specialized running shoes, right? For those of you who are involved in many different activities, especially with sports, and in this case, she also mentions an interest in jogging, okay? It might be worth it to look down the line at investing in a sport leg, right? And then the question comes, well, what kind of a leg do you invest in? So for someone like her, it sounds like she's not going to be a runner, like someone who does races and things like that, like people like me and a couple of my owners do. But she wants the ability to do some jogging. And she even mentions it here. What's a good foot that will allow me to do all this activity, but that's not necessarily the blade, right? So there's a couple of feet that come to mind. And guys, there are hundreds of feet out there. So I'm just throwing out the top 3 that come to mind, but there are so many options out there to choose from. One that I've come to really appreciate lately is the Phil Hour All Pro. That's the one that actually Damon is using. Fantastic foot, has a great response to it. You can do some light jogging on it, and that's what we've been doing with Damon, right? The Oser ProFlex XC, that's another really good one. I also like the College Park Soleus, right? To me, that's just like the trooper of a foot. I don't know if some of you guys who watch my show have seen Reggie Showers. He's a bilateral below the knee amputee. He's been an amputee for forever and a day, and he's tried everything. He did a marathon in his soleus. Now, they're not meant to be running feet, right? And College Park will tell you, no, it's not meant to be a running feet, but those feet can take a beating, right? That's a kind of a great foot for somebody who's very active, right? Someone who has an active lifestyle and that they would like to have a foot that can kind of go back and forth between walking foot and foot to keep up with their activities, right? Another one is, I just had it on the tip of my tongue. Lord of mercy. Maverick. By Freedom Innovations or Proteer. I don't know who has that foot right now. I think it's Proteer. Please forgive me if I'm wrong. But the Maverick is another fantastic foot that I see a lot of my patients who fit this particular demographic that they like to use. So guys, again, this is one of those things where, for those of you wanting to get back to some of those old hobbies or starting a new fitness hobby, okay, have this conversation with your prosthetist, right? Don't be shy about asking, and please don't let insurance be what limits you. There's so many fantastic organizations out there that provide grants, that provide donations for feet. If there's a will, there's a way, okay? And if you have a prosthetist who's creative, they will try to find something to help get you that foot to keep you active, right? That's quality of life, guys, quality of life. As far as the suspension system, so again, if you're having a specialized leg made for exercise, a lot of the athletes that I've seen, they like to use a pin lock just for the exercise leg. For their walking leg, they might stick with the suction system or suspension, the traditional suspension. But the pin lock just gives that extra level of suspension, especially if they're doing running activities, and then a suspension sleeve that goes over everything. And it just really locks everything in, keeps the rotation, prevents a lot of rotation from happening. Okay. And as always, guys, skincare. Keep up to date on your skincare. All right. So that's a good one there. Let me see, get some questions here. And guys, feel free, especially those of you who are new to watching the show, feel free to post your questions in the comment section. I always love to interact and just hear what your questions are. Let's see. There's Marianne. Glad you could join us, Marianne. So I'd like to pose the question to you guys. What feet do you use? Those of you who are in a fitness program, those of you who do adaptive sports, do you have a foot that you like to use? Go ahead and put it in the comment section. I want to hear what your choices are. Oh, don't go quiet on me now, guys. Come on. All right, we'll move on to the next question while I wait for those comments to come in. So interesting thing. So last week we had some questions on knee disarticulation and we just kind of ran out of time. We didn't have time to answer all of those questions. Okay. So knee disarticulation. Some people were saying it's great to have a knee disarticulation. Some people saying, nope, above the knee amputation is better. So I was just like, this is kind of an interesting discussion to have because not a lot of people Brian says from day one, he likes the ProFlex climb. So he likes to do climbing and hike and boating. Awesome. Bonnie is in the sidekicks. Okay. Love sidekicks. Love sidekicks, stubby feet. Love them. Love them, love them, love them. Okay, so when it comes to knee disarticulation, it actually makes up a very small percentage of the amputee population. I think it's only 2%. I think that was the number I got. 2% of amputees are knee disarticulation. Okay, so just a quick anatomy lesson. Come here, Bob. See, even Bob got his ashes today, or a target. I'm not sure what that is for him today. So with a knee disarticulation, guys, it's basically that they disarticulate, meaning they take apart the joint, right? So instead of a below the knee where they leave some of the tibia, they take the tibia completely off, right? And the little kneecap that goes with it, that is completely off. And what is left is the entire femur, right? So the entire thigh bone, the entire femur, including these little knobby ends, they're called the condyles, are left in a knee disarticulation patient. Chuck says, what about the Echelon from Endolite? They're now called Blatchford, Chuck. The Echelon is a fantastic, yes, it is a fantastic all-around foot. It is a hydraulic foot. So again, it's made for a very particular individual. So somebody who likes to having that stability, somebody who likes to be connected. Like that's the phrases I get from my patients who use the Echelon, and then the microprocessor version, which is the Elan foot. They feel very connected, and going up and down ramps is a little bit easier for them as well. But yes, definitely a good all-around foot. Yes. So getting back to the knee disarticulation. So there's a few pros, right? A few good things about being a knee disarticulation, okay, when compared to an above the knee amputee. And guys, feel free to play Monday morning quarterback with this and give me your thoughts on this, okay? So when you have someone who's a knee disarticulation patient, the automatic advantage that they have over someone who's an above the knee is that they're going to have a longer lever arm, right? And this has happened to me a lot, guys, where a knee disarticulation person, amputee, will walk by me and I have to do a double take because they have such a long lever arm. They usually have a better looking gait pattern. And I sometimes from far away might mistake them for a below the knee amputee, and I have to check and see, nope, they've got a prosthetic knee, right? Because of the fact that they have a longer lever arm that gives them an advantage when it comes to walking, okay? Second thing, because they have these knobby ends, the femoral condyles are still intact, they can do weight bearing through the end of their femur, okay? You can't do that as a below the knee amputee. You can't do that as an above the knee amputee. You can't put weight through the long bone there, okay? With knee disarticulation, they can put the weight through the bone itself. So it means that when it comes time to making a prosthesis, right, prosthetist has a little bit more to play with. They don't have to focus so much on keeping the weight off the end of the bone. They can put a little bit of weight on there and make it a slightly less high profile, prosthetic socket as a result, all right? Hey, Marcus. Oh, it's a party now. We've got Marcus and Pastor David on board. All right. So those are some of the advantages, right? Now, the other, and obviously because of the fact that it's a longer lever arm, they also have longer muscles that go with it, right? All right. So some of the disadvantages to being a knee disarticulation versus an above the knee, because of the fact that they have the femoral condyles, right? It creates a bulbous shape, especially when they put the soft tissue around it, right? So the problem with that is when the person's trying to put their limb into the socket has to be wide enough, right, to accommodate that limb going in, and then it might be too big on top, right? So that's some of the prosthetic considerations. This is where something like an adjustable socket can come in very handy, right? They can expand it, put the limb all the way in, and then tighten up either through the top or through panels, right? Okay. Another big thing when it comes to being a knee disarticulation patient, and again, this is just something that I've heard over the 20 years of being a clinician and just reading a few studies here and there, the leg length, okay? And some of you have mentioned this last week. When a person has the full length, and then the prosthetist has to basically make room for a prosthetic knee and a pylon and a foot, right? it's going to throw off the knee, and it may not match up with the anatomical knee. So when the person sits down, right, the knee disarticulation might stick out more because there's the knee, there's the actual bone, right? And then the prosthetic knee that sticks out with it, right? And some people have a problem with this. Some people really don't like how that looks. And then as a result, sometimes the leg, when they sit down, the prosthetic foot might not touch the floor. It might just be kind of swinging in the air like that. And some people really just don't care for that. Okay. So these are just some of the things that people, people were starting to kind of talk about last week. And I just kind of wanted to bring it up in terms of knee disarticulation. I don't know if do I have anybody listening tonight who's a knee disartic? Tom says, I have the Oser ProFlex, the ProFlex X, the Cheetah. Love the Cheetah. XC Blade and the Empower Bionic Foot. There you go. Yeah. You've got a nice collection there, Tom. He's got some good stuff there. It's a nice closet right there. All right. So guys, y'all are quiet this evening. This is very unusual, very unusual. All right. So I'm hoping it's because you guys are saving it for next week when I have Dr. Dumanian on board, right? Is that what it's going to be? All right. Last question that came in, which by the way, guys, if you have any questions, throw them in the comment section now. Last question that came in is this is actually a question I need from you guys to help me out with. And also those of you who are watching the replay, as you watch this, Haravam says, I don't know about disarticulation, but my stump is long as an above the knee amputee. Hey, Kathy. No, and I was just thinking, one of the people that I follow on Instagram, her name is Daniela Alvarez. She is the former 2017 Miss Columbia. Beautiful woman, beautiful woman. I think it was almost about a year and a half ago, she had a surgery and just complete, like out of nowhere, developed ischemia in both of her legs. So she lost one leg as a knee disartic. And then the other leg, there was just so much damage that she's got a drop foot on the other side. And it's interesting. I really enjoy watching her videos. She's an amazing woman to just watch her life. But it's interesting because the side where she has the amputation is actually her stronger side. And that, in some of the videos where you can see her walking, the side with the foot drop, right? From what I can see, seems to be her weaker side. And the fact that she's a knee disartic and not an above the knee, I think has really allowed her to have a pretty decent, strong gait, and she's able to get up and move around and do quite a bit. But again, that's just an example of how having that long lever arm has given her that advantage. So just one of those side note things. Marianne says, just being funny, but my feet never touch the floor unless my butt is on the floor. Marianne, you crack me up. Let's see. Tondeo says, I've been waiting for more exercises for above the knee amputees. Well, Tondeo, I think I can just help you out right now. Sorry, I'm like taking forever to type. Okay, Tondeo, I put a link in there for my program. It has 150 exercises for above the knee and below the knee amputees, head to prosthetic toe. So check out that link. There's 150 plus videos. There's books to accompany. Guys, my above the knee book, FedEx tells me it's going to be here tomorrow. FedEx, are you listening to me? I want those books tomorrow, like you said you're going to do. Okay. All right, let's see. Jean says, my amputation is just above the knee, but have the same issues sticking out and foot doesn't touch. And again, the longer your amputation is going to be, that's going to be the problem. But again, guys, it's, and I'm not an amputee, so I'm only commenting from the point of view of a clinician working with amputees for so many years. The longer the lever arm you have, the better your advantage. It's not to say you're not going to have issues with prosthetic fit and alignment. Yes, absolutely. But ultimately in your everyday walking, the longer that lever arm, every inch counts. Every inch counts. So, yeah. Let's see. Brian says, advised 2 days ago from my original amp doc to have revision, said the bottom of my fibula needs to come up. Okay. Luckily, he had original left plenty the first time. Is this hard to match the full leg height? Possibly easy since it's below. So again, Brian, hopefully I'm answering your question. Usually when it comes to below the knee amputees, the biggest kind of issue I see sometimes when it comes to prosthetic fit is that some amputees who have a longer tibia, have a longer amputation, may not be able to use certain feet, right? So when you get your prosthetic foot, and my microphone is sitting on top of my Satch foot. So when you have your prosthetic foot, depending on what kind of a foot you have, there's a certain amount of height that needs, it's called the build height, right? So there's a certain amount of height that your prosthetist needs to be able to have. So if you have a super, super long amputation, you may not have space basically to fit the foot on, and you have to choose a different foot. So that's something I see that I run into sometimes with my, some of my below the knee amputees when it comes to certain feet that I like to use. And it's like, oh, we don't have the build height for it. Okay. Yes, Kathy, you need to join. Thank you, Tondeo. Yes, Patricia. Oh my gosh. I've been waiting for this book, this above the knee book, forever. Let's see. I'm not familiar, Haravansh, with the Dettol, so you'll have to kind of explain that one to me. Okay. So did we get everything? Oh, this is the question. So guys, this is a question for you guys. Okay. A gal named Lori emailed me. She's a right below the knee. And she wants to know recommendations for custom skin companies. And I was like, I haven't had that question in a long time. And it just kind of got me thinking. And guys, go ahead and start putting comments in the section if you have any ideas for this. When I started working in my profession 20 years ago, when dinosaurs roamed the earth, most of my patients had cosmetic covers and they weren't very good, right? It was kind of the cheap nylon looking covers for the legs, right? Fred's legs. Thank you, Brian. They weren't really great. And then as the years have gone by, it's been flip-flopped. The majority of my patients don't use a cosmetic skin cover. They just like having the pylon and the show your metal kind of look, which I think is kind of cool. But I've also seen advances in these custom skin covers. And for me, like there's one particular clinic here in town, West Coast, their stuff is phenomenal. Like I love going through their feed because they'll do that hole where they put the hands next to each other and you have to try to figure out which one's the prosthetic hand and which one's the real hand. And the same thing with the feet. Whew, right? Amazing, 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 right? Oh, there we go. So Lori, Southwest Florida or Colorado Springs area would be great. Fred's legs. So guys, what I've kind of noticed is like in the big cities, there's usually one clinic that kind of does the really great job on making and really just perfecting the cosmesis with some of these cosmetic skin covers that they do, especially with the fingers and the hand. It's kind of fascinating to look at. I know I'm a nerd, total nerd here. So Dettol is an antiseptic. Okay, disinfectant liquid. Okay. Okay, so here's the thing, Haravansh. That's actually a very good question. So he's asking if using an antiseptic and a disinfectant liquid will make the limbs sensitive over time. So when it comes to skincare management, guys, especially when it comes to antibacterial agents, right? I'm very careful. Okay. Again, right about the time when I started my career, all of these antibacterial agents started coming out on the market. We started having, we call it Germy gel here in my household. We started having antibacterial soaps, antibacterial sprays, antibacterial everything. And I remember I was in the hospital and I just finished working with a patient. So, I was washing my hands and using the antibacterial soap, and the infectious disease doctor just happened to be next to me. And he's like, why are you using antibacterial soap? And I'm like, well, it's the only one they got for me here. And he goes, you're killing off all the natural flora in your hand. He said, just using regular soap and, just the movement and the friction of washing your hands, that's going to get rid of those germs, right? The study showed, is it a 2 minute, then the amount of time it takes you to sing happy birthday 2 or 3 times, right? That's all you need to get clean. Okay. So when it comes to the skin on your residual limb, guys, if you're being really aggressive with these super antibacterial agents, number one, you're going to probably irritate your skin. Okay. Number two, you're killing off the good flora, the good stuff that lives on your skin that helps protect your skin. And every once in a while, yeah, I will have a patient who, or I'll see someone on Facebook that they watch. Oh heavens, and I'm forgetting the name of it right now. Boy, I'm having a mom brain moment tonight. The agent that we use prior to people going into surgery, it's an incredibly powerful antibacterial, right? It's so powerful that that's what they have you scrub with the night before you go into surgery, right? So they're using this, they're killing off the good stuff. And then if they happen to get an infection, their body's not going to know how to defeat it. Okay. Now, are there exceptions to this? Yes, there are exceptions. So there are some people who are prone to MRSA, who are prone to some of these really intense infections, and they get them regularly. Okay. So that's the case where your dermatologist should be the one to determine if you're using a more aggressive cleaning method. Okay. Does that make sense? But guys, when it comes to cleaning and keeping the skin clean, it's the get into the bath or shower once every 24 hours rule. And we live in hot, sticky Florida, right? So things here get sticky, humid, and smelly, right? Once every 24 hours, the limb should be bathed with water and a gentle soap. Okay. Love the cleanser, right? The Vital Fit cleanser. Always love that because it's gentle enough for the skin, but it also helps with bacteria, sweat, and odor. Okay. Does that make sense, guys? Okay, so Tondeo, and I hope I'm pronouncing your name correctly. I became a left above the knee 2 years ago due to a slip and fall, and the infection spread to the knee replacement. I had double knee replacement 6 years ago. Now the right knee replacement is kind of loose, and they have me in a knee brace that keeps me from hyperextended. Doctors feel like I'm carrying too much weight on the prosthetic, but they plan to do the bariatric sleeve. And then, okay. So yeah, guys, if, and this is a, slightly ticklish conversation I've had to have with some of my own patients when it comes to the amount of stress on the human body when you're using a prosthetic device. Okay. And your weight is a huge factor, right? The weight is a huge factor. It's simple physics, guys. The more you weigh, the more your joints have to carry, right? And even prior to, even outside of the amputee population, guys, I've had so many cases of people who were, around the corner from a major spine surgery, around the corner from knee replacements, hip replacements. And because they got themselves down to a healthy weight, they were able to avoid surgery just because all that stress was lifted off the joints. So when I talk to my patients, I do talk to them and I ask them, we take a look, are they at a healthy weight? Did they gain a lot of weight after their amputation? That happens a lot because people become sedentary after amputation, right? They don't have a way to exercise. Okay. And talking to them to see if they're not at a healthy weight, how can we help them get there in a healthy way? Okay. And that just is going to set you up for success, just even more success with using your prosthesis. And, let's face it, staving off some of these issues that come up, later on down the line from carrying excess weight for a long period of time. Adam says, I had my first skin breakdown and infection today. Oh, got prescribed 3 antibiotics and was told not to wear my leg for at least a minimum of 2 days. That stinks. That stinks, Adam. And hopefully, that just stinks. Guys, a lot of you guys chuckle sometimes because I know I go off on my soapbox. Excuse me, Bob. I know I go off on my soapbox about protecting skin and making sure that you don't get blisters and you don't get skin breakdown, but it's because of this. It's because when you do have skin breakdown and a blister, it's game over until that is healed. There's just no way around it. And especially if you're looking at an infection, it's game over until that's healed, Adam. And I will say this, Adam, once it heals completely, you're going to want to, and Adam, I think remind me, do you have any of this stuff, the Vital Fit stuff? When a blister or a wound heals, right, they've got that new skin, right? And that skin takes some time to kind of toughen up a little bit, not with a callus, but just kind of get back to its normal, right? So in the meantime, when you're starting to wear your leg again, you need to watch that area because that's going to be an area that might break down again if you're too aggressive. So if I have somebody who's got a newly healed blister, newly healed wound, and we're getting them back into the socket, I'll use a liquid to powder, the VitalFit liquid to powder, and it just helps decrease the friction in that area, take some of that pressure off there. Absolutely, Haravamsh. Patricia's like, VitalFit all the way. HibaCleanse. Oh my gosh. Thank you, Pastor David. That was driving me nuts. Yes. So yeah. And I've seen some videos of people that they're talking about how they use HibaCleanse every day to clean their residual limb, to clean their liner. And guys, I know it's technically available over the counter. It used to be that you needed a prescription, right? Before you would go into surgery, your doctor would prescribe it to you. You would pick it up and then you would scrub yourself the night before surgery or that very same morning, right? To basically kill anything that was living on your body, right? And now it's available over the counter and it says its ability, it can be used and this and that and the other. And I just respectfully disagree with that. I think it's a very aggressive agent. It's a very aggressive agent. And to the people who say that they use it every day and they don't have a problem, bless your heart, good for you. But other people that I've known that have tried using it, it can be aggressive. And guys, I've had my fair share of surgeries myself. So, I used it when I had to have surgery and that's it. That's it. All right. Melissa says, I use my facial cleanser Cetaphil to clean my limb as well as my liner and my sleeve. It's worked for me so far. Yes, Melissa, I love Cetaphil. Cetaphil is a wonderful, everybody can use it kind of cleanser. And I agree. If it's a very gentle cleanser and if it's gentle enough for your face, right, to use, and my dermatologist recommends it, I love it. If it's gentle enough for your face, it's going to be gentle enough for your liner and for the skin on your residual limb. And that's honestly how you have to think of the skin on your residual limb. Women, we're a little bit more in tune to this because we have all the magical facial potions and creams and stuff that we like to use all the time on our face, right? So taking care of your residual limb is a lot like taking care of the skin on your face. It's going to be that much more sensitive and it's going to need a little bit more TLC. Okay, so Bonnie says, is there another product you recommend instead of VitalFit? They use aloe and I'm allergic. So Bonnie, I'll be honest, it's been a long time. Like the past couple of years, it's been all VitalFit. I would look into something like Cetaphil, Bonnie, in terms of the cleanser. Okay, when it comes to lotions, I've got a hard time. I've got a really hard time recommending drugstore lotions only because they tend to create like oil slicks on my patient and they just don't absorb all the way. With some of the liquid to powder, there are a couple of options. I think it's, oh, Bonnie, and you'll have to check the ingredients list on it because I'm not sure if it contains aloe or not. The Gold Bond medicated powder, that's another option as well. And I used to use that once upon a time. With patients as well. But as far as lotions, I never was able to find a lotion, Bonnie, that my patients could use while they were wearing the prosthesis. Okay, here's one thing you might want to consider, Bonnie, and this is something I used when I worked in the burn trauma center, cocoa butter. And again, read the ingredients list. If you're somebody who has skin sensitivities, make sure you read through that list. But I liked using cocoa butter on my patients who had burn and skin grafts after the grafts were healed. It was a nice moisturizing agent. But again, when I would put it on my amputee patients and then put the prosthesis on, it would just be too slippery. But for nighttime, that might be a nice option for you if it doesn't have any ingredients in there that you're allergic to. Marianne says, a crap load of surgery took care of my weight problem. Marianne, you're killing me. All right. VitalFit, Tondeo. So if you go, it's called Vital. If anybody has the website, that would be awesome if they can post it. I think that's the website, VitalFit. And then I have a discount code so you guys can use, it's Cosi 10 and it gives you a little discount there. Let's see. Yeah, the liquid to powder, it's nice. Honestly, it's very nice. And Adam, if you're somebody who's very active, you'll find that that's also a very helpful agent right there for when you're being active and running and stuff like that. Oh, Kathy says, I used to use it every day and stopped because of you saying not to. Oh my goodness. And again, guys, this is based on 19 years of practice and just what works. So there you go. Patricia says, I used the Hibiclens initially after my amputation, had a lot of skin issues. Ever since I started Vital Fit, I've had no skin issues. I use the liquid to powder, night moisturizer, and cleanser on residual limb and liner. And again, guys, not one fit all, not one size fits all, but this one, the Vital Fit, has been like a 99% fits pretty much my patients and viewers. It's got enough in there to combat sweat, bacteria, and odor, but not too much that it's irritating your skin or killing off the good stuff, right? Let's see. Chuck says, our wound care doctor recommended skincare cream and got it from Amazon. Here's the thing with the skincare creams and all these other drugstore things, Chuck, is that it's not meant to be used inside of one of these. Okay. So again, a lot of the lotions and potions you're going to find out there, they might be very good for your skin, but they might degrade the integrity of your liner. Okay. So that's something you got to think about and ask your prosthetist about. And B, a lot of these agents may not soak all the way into your skin. And the minute you start to sweat, you start to get a little slimy, and that starts to create rotation and friction within the socket. So that's the problem I would run into when I would try any of the over-the-counter lotions on my patients. Let's see. Hey, Patrick, there's my fellow physical therapist right there. Yes, with the incision itching. Yeah, definitely. So if you have a closed incision, it's already healed, right? That area of incision, that area of skin is not going to have sebaceous glands, oil glands, or sweat glands. Okay, same thing with people who have widespread skin grafts. If a person has a skin graft, that area of graft does not have oil glands or sweat glands. So it's going to be unbearably itchy. And the larger the skin graft, the more it itches and the more sensitive it is. It doesn't have those nice natural oils that are lubricating that part of the skin. So again, like I said, when I worked in burn trauma, cocoa butter for me was a lifesaver for my patients, because once their skin grafts had completely healed, that cocoa butter just gave them that moisture and a little bit of relief from that itchiness. But yeah, when it comes to using it under a prosthesis, it hasn't worked. Yeah. And again, guys, it all, I've had some old timers come to my clinic and they say, this is all I've used is bar of dial soap my entire life, nothing else on my skin, and I've never had a problem. And I say, keep doing that. Keep doing that. But, most of the people who come to see me, they usually have something going on with their skin. All right, guys, great discussions this evening. So guys, as a reminder, next Wednesday, who's coming on my show? Come on. Where are my smarty cats? Who's coming on my show next week? Somebody really, really cool. Okay. Dr. Gregory Dumanian. Okay. He is the gentleman, the surgeon who pioneered targeted muscle reinnervation. He invented this procedure, guys. Like, this is kind of cool. This is history coming on my show, right? He is coming, TRM, close to Pastor David, TMR. All right. He is coming on my show next week, guys. And TMR, targeted muscle reinnervation. This is a surgical procedure that is used to help with pain in the residual limb that is caused by a neuroma. And I know that there's a lot of you out there who either have a neuroma, you're having phantom limb pain, you got something going on, right? So the gentleman who pioneered this surgery is coming on my show next week, and you can bring him your questions directly, okay? We're going to go into what TMR is. We're going to show some love for our upper extremity amputees, because TMR was originally created to help upper extremity amputees, right? And now we're seeing how it's helping the lower extremity amputees, right? All right, guys. So next week, set the alarms on your phones. I'm tapping at my watch. Set the alarms on your phone. I want to see you here with your smiling faces next week. And we're going to, of course, have some giveaways to do that. All right. All right, guys. That's it for this evening. As always, thank you for letting me be a part of your lives. If I missed your question, please don't be shy. You can send me an email directly to my Cosi Talks. If you haven't had a chance already, check out my Strong Body website, right? Check out those 150 exercises for above the knee and below the knee amputees. All right, guys. I'm going to go ahead and sign off for this evening, and I will see you next week. Same bad time, same bad channel.